Hello, everyone, and welcome to the Women of Wisdom Lavender Lounge. I am Phyllis Tucker Saunders, your host for today, and we have some exciting things to talk about. We're going to talk about women's health, and you can't talk about the health of women of color without talking about disparities. And the expert today that is going to be joining us is Dr. Cunningham, and I say, welcome, Dr. Cunningham.
Hi, glad to be here. Thank you so much for having me on today.
You are welcome. And today our theme is all about health and wellness for women of color. And I read in the New York Times the 1619 projects, and I want to make a quote from them. It said the COVID-19 pandemic laid bare the racial inequities that plague American healthcare, with Black people dying of the disease at a rate more than double that of white people. And it further states that the death of Black women's children and the dismissal of their pain, voices, and experiences is deeply tied to the legacy of slavery. Now,
Yes.
These are some powerful statements, and I would just like to get your opinion of what you think of that.
Yeah, I definitely agree with that. And it was unfortunate that it took a pandemic, to kind of push and urge the country to see this devastation that's been in the Black community for centuries. This is not anything new. A lot of us who work in this space, who are passionate about caring for our Black communities, we were aware of this. And it took for a pandemic to highlight some of the issues that a lot of the Black professionals been speaking on, a lot of the Black physicians, we've been speaking out on this. So it's definitely true, even embedded in medicine. There's bias. We were, coming up, we were taught to look at our algorithms for medicine, took account of someone's race, and we were taught to think based off of to triage by race with certain diseases, and that was embedded in medical school for centuries. And it wasn't until a lot of intention was put on the Black community with the pandemic that people started to uncover and realize, wait a minute, even in medicine, there's some embedded racism in how our doctors are being taught, how the medical students are being taught. And so while I'm thankful that this took place, it's just unfortunate that it took for us to lose so many lives, and it took so long for this to become to the forefront of the country to recognize it. But it does go back to slavery. Even when we think about chronic pain and how we manage that, there was quite a few studies that came out that looked at physician beliefs, medical students' beliefs with managing Black people with pain. And a lot of people thought that, Black people's skin is thicker than white people, or our nerve fibers are not as sensitive to pain. And so the way that we approach chronic pain for years and years and years created a disparity in who had access to equitable treatment and who did not. So even with that, it's embedded in a physician passing judgment based off of somebody's skin color, and this idea or belief that as if I'm Black, that means my skin is much thicker, and that means that my pain tolerance is much higher.
So, Dr. Cunningham, so when you were in medical school, did the professors actually say those words?
Yeah, we were taught, they didn't say that exactly, but we were taught, for example, when we had to discuss our clinical cases, we had to say a 55-year-old African-American male. And then, some of the cases that we were taught, like sickle cell is a classic example, we're taught to link sickle cell disease to Black people or African descent. And so sometimes how the clinical cases were designed, it was getting you to think about it in that aspect. Going through, thinking about other examples, certain formulas, certain algorithms, certain things that we were using, it incorporated race, and it made us start to believe that because of somebody's skin color, that meant that X, Y, and Z was different. So that was embedded, and it was a norm. And just think that went all the way back before I got into medical school, before any of us. This is what was taught because that's what they thought. And now fast forward, now we understand that systemic racism and implicit bias, that was embedded in medical school. So now we have generations of doctors who were exposed to this. And it makes sense as to why we see some of the disparities, specifically in the healthcare system. But it's a lot of us are aware of it, and we're working diligently to undo some of that. But we're talking about undoing centuries of training that persuaded physicians to think a certain way. I will also say that sometimes as a physician, we use use our clinical knowledge to make decisions and assessments, but a lot of it is based off of the physician asking the appropriate questions, listening to the patient. If the physician don't listen attentively to what the person is saying, they can automatically jump to a conclusion or miss a diagnosis. So, we practice medicine, and unfortunately, the way that we would practice was skewed by some of the medical education that we would receive.
Okay, Dr. Cunningham, I do have to go back because I really didn't tell everyone who you are and what your expertise
That is okay.
So Dr. Cunningham is the director of St. Louis County Department of Public Health, and she has served as Associate Medical Director at Family Care Health Services and as a clinical instructor at St. Louis University School of Medicine. Dr. Cunningham's expertise lies in opioid and overdose epidemic and how this serious medical issue affects those women living in underserved neighborhoods. A St. Louis native, Dr.
Yes.
Cunningham holds degrees in both medicine as a board-certified family medicine physician and public health degree from St. Louis University. Now, Dr. Cunningham, I'm going to go off script here a little bit. When this opioid thing came to, and now, the other people are being affected by it.
Yeah. You said white people are being affected by it.
Okay, I can't say white people. Okay, they treated very differently
That is
than
true.
they did back in the day when our people were on drugs.
I agree.
Talk a little bit about that.
Yeah, I completely agree. I think that's that's one reason that drove my passion for this. So the more I educated myself and understood the historical aspect, I understood the racism aspect behind it, the more I became a sounding board in my community and a huge advocate, because you're absolutely right. With with our community, with the Black and brown community, it was punitive measures, it was incarceration, it was ripping families apart, it was you're a drug addict, there's no hope for you. And it created this stigma within the Black community that if somebody was using drugs, oh, that's a bad person, you don't mess with them, grab your purse, that's a low life. That was what we were taught to believe, and the media portrayed us. If you look at back in the 80s and the 90s, back in the 80s, on the front of a Time magazine, it was crack babies. So I would say the government and the media used stigmatizing language, and it persuaded the Black community to believe that this was inherently bad. We're bad people for this. Fast forward years later, now it's in the white community, even just the change in our terms, drug addict, you on drugs. Now we're saying opioid use disorder. They call babies crack babies, and now we're saying neonatal abstinence syndrome. So even the terminology has changed because now it's affecting the majority of the community. And now we're going to look at it differently. And so
it's a medical condition.
It is. It's yes. Opioid use disorder. That is a chronic medical disease. And that is one thing that I talk to people about, that for us to see and understand that it's not just as simple as, oh, you need to quit. No, this is a medical disease that requires access to life-saving medical treatment. It requires access to important services that individuals in our community at one point in time didn't have access to or didn't receive. So you're absolutely right. And when I talk about it, I was like, yes, that is a fact. Once it hit the white community, it hit the white suburban areas, the moms, the kids, the nephews. It was a completely different issue. And now we're getting millions of dollars to fund treatment programs, to increase access to treatment. We're paying for medications. Insurance companies are covering this now. When before it wasn't like that. Our communities was left to fend for ourselves. And so for me, if you could tell, that's something that I'm really passionate about. And once I learned about that and I saw that it was clear as day, that's when I became very, very passionate, not only offering treatment, but also educating all communities, and specifically the Black community, because for us to really get through this, it's going to take everyone, not just the individual family member, not the person that's using, but it's going to take a community approach for us to address this. And we need to destigmatize our language and destigmatize what does it mean for somebody to access care and treatment if that is what somebody wants.
Yeah, we really appreciate you and what you're doing, and it's very important. Now, let's just move on. There's a term called weathering, which refers to the bias in the healthcare system, and the term was developed by public health professor Dr. Arlen Geronimus. I think I'm pronouncing that right. The term refers to the wear on the body that results from prolonged exposure to stress. Now, your heart rate goes up, your blood pressure rises, just etc. Everything. So explain to our audience the effects of stress, especially from racism, on the body.
Yes, that is really huge. So when somebody, you have your blatant stress, I mean, your blatant racism, meaning that, somebody call you the N word. But it goes all the way down to there are daily acts of racism that take place that some people may not be able to name what that is. They may not be able to understand what's taking place because as a society, some things that we're taught to think like a white person, or we have these white supremacy ideas in which we're supposed to believe that this is okay for somebody to talk to me in this manner. So all the way down to your blatant upfront racism and down to day-to-day things that can take place to where somebody can perceive racism. The stress that mounts, our cortisol levels will increase. It can increase our risk of hypertension, diabetes, as well as stroke, heart attack. All of that can take place if their bodies is being prolonged to stress over time. And we tend to not think about racism doing that same thing, but it does. It actually causes a physical response in our bodies, and we're responding to that. And people may not understand that I have been consumed in this country, in my job, in my career, in my community, that this is what I'm facing on a daily basis. And if you add on top of that gun violence, what's taking place in a lot of our communities across the country, that will double that. Just the near fact of a kid being exposed to bullets, that is added stress for that individual, that kid. So it does cause physical trauma, physical harm to the body that will manifest in later years as those chronic diseases.
Dr. Cunningham, tell us how women of color can achieve better health, and what would be your recommendations on establishing a good and healthy relationship with your doctor?
Yeah. So I think a few things with that. The biggest thing is finding a doctor that you connect with. Sometimes people feel like they have to stick with the first doctor that they see. Once you find that doctor that truly will connect with you, and when I say connect with you, meaning a physician who will listen to you, listen to what you have to say, not cut you off, but truly listen not only with their ears but with their heart. That's something that I as the Black community, especially as Black women, do your due diligence to find someone. Don't feel like you have to stop at that very moment. And a good doctor will always listen and put you first as a patient. And not only that, they won't tell you what to do. They will invite you into the conversation because this is your body and you're in control of what takes place with your body. And I think having that perspective and finding that right doctor will help promote wellness for anyone. And I also say take autonomy and ownership too for our own health and bodies. A lot of times I think I have a minute, you tell me. But there are some things, that I always recommend for Black women: mammograms, pap smears, blood pressure, diabetes check, cholesterol check, also just monitoring your weight. Those are some things that you can take a preventative lens with, making sure that we care for our own bodies and just promote your own wellness. But it's really key to find that person you connect with, and don't be upset to say, you know what, I'm not having a connection with this person. Let me find me a different one, because they are out there.
Dr. Cunningham, thank you so much for joining us.
Thank you.
To all of you in our audience, stick around and check out what's happening in the Wild Gardens. We have some seeds of wisdom to plant with Jasmine George.
Hi, I'm Jasmine George, a student at Prince George's Community College. Let's sow a few seeds of wisdom about today's theme: health and wellness for women of color. What is nearer and dearer to us as women and as people than health? Women of color, African American women in particular, are more likely to face health challenges than their white counterparts. For example, African American women are significantly more likely to experience heart disease compared to other ethnic groups. Cardiovascular disease affects 47.3% of African American women, and we have the highest rates of hypertension, stroke, heart failure, and coronary artery disease of all groups of women in the United States. With these sobering stats in mind, it's important to be in control of your health care. How do you do that, you ask? You should maintain a good relationship with your doctor, but be aware that your doctor is not in charge of your health. You are. Never be afraid to ask questions, get a second opinion, or even change providers. You know when you're experiencing abnormal fatigue, more pain than usual, or when something just doesn't feel right. You know your body best. Did you know that Black women are more likely to be diagnosed with breast cancer at a younger age, at later stages, and with more aggressive breast cancers than white women? Dr. Cunningham is correct about taking preventative measures and having agency over your body when discussing your own health with your physician. You own your body, and you and your doctor should treat it well. Pun intended. I hope these seeds of wisdom grow in your soul. I'm Jasmine George. Have a healthy day.
To join Women of Wisdom, go to pgcc.edu. Be sure to check out the Lavender Lounge on our PGCC TV and on social media via the PGCC TV online YouTube channel.